Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now here is your host and founder of Laser Therapy Institute, Dr. Jason Rountree.
Welcome back to the podcast. My name is Dr. Jason Rountree, and I'm your host again today on Healing at the Speed of Light. This is a weekly podcast that we do on laser therapy and how patients can benefit from laser therapy. I've been in the laser therapy industry for years now. We deliver thousands of treatments every year, and I'd like to address a topic today that I have steered clear of for the last year. Somehow I haven't managed to do a year of podcasting without ever touching on this subject. The subject is, how much does laser therapy cost? Now, if you've been here with us on the podcast for any amount of time, you've heard me talk a lot about the evidence for laser therapy and how well it can work, how many treatments it might take, what type of laser is good, how to find good, effective laser therapy care. But what about the cost? Because cost is important. You have to be investing your money into therapies that are going to work, that are not overpriced, and that are not going to have the risk of further damaging your body, because you only get one body. So every dollar you put into a treatment or a therapy is an investment into your body. So I want to take today's episode and try and answer the question, how much does laser therapy cost? Is it affordable, or is it only something that the wealthy get access to? Now, the first question that most people have is, will my insurance cover this? And I'll give you the answer to that, but I'm going to make you wait for it. I'm going to make you wait to the end. I want you to hear a few other things before I give you the answer to that one. Understand first that every dollar you put into your body is an investment, right? It can be your investment, or the insurance can help you with that investment. But your insurance's job is not to make you healthy. Your insurance's job is to make a profit. Keep that in mind as we go through this topic. Your insurance is there to try and profit as much as they can. That's their job. If you can utilize insurance to help offset your costs of keeping you healthy, that's great. That's why you have it, right? But remember, their job is to make a profit. Now, that doesn't hold true for our public healthcare programs like Medicare and Medicaid. Those are designed, though, to spend as little money as possible to save taxpayer dollars. So even Medicare is not necessarily interested in your health. They are interested in spending as little as possible. Before I get into the cost of laser therapy, how much it costs, is it affordable, I want you to first understand that I'm not recommending that you get laser therapy. I would recommend that if you have a condition that you think might work with laser therapy, find a Laser Therapy Institute clinic near you. You can go to our website, lasertherapyinstitute.org. You can find out if there's a clinic near you, or you can contact us and we'll help you find someone. But the first step here is getting evaluated to even know if this is an option for you. Then if it is, evaluating what kind of cost is going to come along with it. Before you go and get evaluated, I want you to do me a favor. I want you to put a value on your condition. I want you to figure out how much this condition costs. Whatever it is, doesn't matter. And when I'm talking about how much your condition costs, think about it this way. Let's say you're suffering with plantar fasciitis. You've got foot pain, and it really gets you in the morning. It keeps you from staying on your feet for very long. It limits the distance you can walk. So maybe it keeps you from working a full day at work. Maybe it means that you can't go hiking on the weekends now, or cross-country skiing, or you can't play tennis or pickleball like you'd like to. So you're missing out on those things. Well, if you miss a half a shift of work and you get paid $20 an hour, you miss 4 hours, there's $80 you missed out on, right? That's a hard number. This condition has now cost you $80. What about hiking? If you give up weekend hiking because you can't do it, how much is that worth to you? Is that a $50 hike? $100 hike? How much would you pay for that hike to do it pain-free? That adds to your cost. What about losing out on those off-day pickleball matches and the socialization that goes on, having a good time, fresh air? How much is that costing? To put it a different way, if you were involved in an accident that injured you, and this was the injury from that accident, how much would you be telling your attorney you expect to get for pain and suffering and dealing with all these missed opportunities and missed activities, missed work? How much would you want? I bet it's a lot more than a couple $100. I bet it's several thousand, because these conditions that affect the way we live have more than just a monetary cost from missing work. That's a factor for sure. But what about time? What about the things you love to do? What about not getting as much joy out of chasing the grandchildren around because your feet are killing you? And that's just using a plantar fasciitis example. This works for back pain. This works for significant diseases like neuropathy or Parkinson's. How much is that costing you? I want you to keep that in perspective, because there's a real cost to letting a disease go on. And as a matter of fact, in some cases, there are no other options. Think about neuropathy or traumatic brain injury, stroke, chronic regional pain syndrome, CRPS, Raynaud's disorder. There's not really good treatments for those. There's a couple of medications that can sometimes reduce the symptoms, but if there's not another option, then how much would you pay for the only option that's out there? I'm not telling you you need to max out all your credit cards to get a couple of visits of laser. I'm just saying I want you to think about what the cost of your condition is, how much this is bugging you. Even a minor condition, say a mild case of neuropathy that affects your balance, can have huge costs, because what if you do lose your balance, you fall, you dislocate your shoulder? Now we're talking about more significant costs, right? There are hidden costs, there are time costs, there are costs in activity. And seriously evaluate that before you go in to get checked to see if laser therapy could be an option, because you need to have a sense of scope of what type of problem you're dealing with so that you know whether this is something you want to do or not, but also so you can put the right level of importance on it. And let's just assume maybe there is another couple of options for your condition, say like a knee sprain or a muscle strain in the back. Sure, maybe you can get a prescription for that, but what about the co-pays for the drug? What about the side effects that drug might have? Medication interactions that could cause you to have a negative reaction, and then you have to change your other medications around? What about having to go to multiple ongoing PT visits, time spent doing home stretching and exercises for something that's not resolving and getting better like it should? I had a patient just a couple months ago that came in. She had a pretty good sized fall. She strained the muscles in her back. She had gone for 2 to 3 months of PT and medications, including Flexeril, a muscle relaxer. And she had gotten about 50% better, but she was left with this significant muscle pain in her back. It was not going away. She showed up in my clinic. We did a handful of treatments, I think maybe 10, and she was great. She was better, but she had waited so long to get here, she had missed out on almost her entire summer. There's costs to this, even when there are additional options for your treatment, like PT, like medications. You need to consider the total cost, those missed times of things you wanted to do, the appointments you have to go to, running to the pharmacy, buying the medications, feeling groggy so you can't go to church that next morning, or whatever activity that you might want to be doing because of medication side effects. Seriously think through this and put your doctors on the spot too. What am I giving up for these treatment options here? Now, you know me, if you've been listening to this podcast for any amount of time, I don't like to just throw out statements. I like to use evidence. So I've got a couple of quotes for you. This quote is from an article published in 2016 in the journal Photomedicine and Laser Surgery. The article is titled "Quantum Leap in Photobiomodulation Therapy," or light therapy, ushers in a new generation of light-based treatments for cancer and other complex diseases, perspective and mini review. In this review, they say that it is time to begin considering light therapy as a potential drug equivalent. In addition, light therapy may have minimal or no adverse effects, improve quality of life and functional status, and raise the current standard of care. They say light therapy can also offer a non-invasive and cost-effective therapeutic option for patients with neurodegenerative diseases, things like Parkinson's and Alzheimer's. They go on to say that light therapies will preserve quality of life and raise standard of care in an efficient and cost-efficient manner. Another quote, this one is from a guest editorial published this year by Dr. Rountree in Photobiomodulation, Photomedicine, and Laser Surgery. And he says the use of laser therapy in ambulatory medical care seems to offer a considerable reduction of public tax spending. And there he's talking about public programs like Medicare. As a matter of fact, in this editorial, Dr. Tunais goes on to say that it's somewhere between 30 and 86% savings for some conditions with light therapy. That is a big deal when you consider the total picture of how much patients have to spend on medications and doctor visits and therapies that they have to go to. When you can include light therapy, laser therapy for these conditions, it brings the cost of care down. So what is that cost? I know you want the answer to the question that we posed here at the beginning. How much does it cost? Well, as you know, I'm probably going to say it does depend on you and your situation, how many treatments you need, what kind of insurance you have, what clinic you even go to. Because in some states and some clinics, we do get pretty good insurance reimbursement where the insurance can help pay for those treatments. In other cases, that's not an option, and you'll need to do a self-pay method where you can pay for the treatments out of pocket or using a HSA, a health savings plan. Or sometimes clinics will let you prepay for a block of treatments, a certain number of treatments, to get a discounted rate. Let me tell you, a trial of laser visits is affordable. And when I say a trial of laser visits, we're talking about 6 to 12 laser visits is an affordable choice if your doctor thinks this is an option for you. Because somewhere in that 6 to 12 visits, you are likely to see results. And if you don't, in many cases, it's time to go ahead and move on to a different therapy. But 6 to 12 visits is not that expensive. In most clinics, you're looking at somewhere between $50 and $150 per session. 9 treatments on average, that is not going to cost that much when you consider all the other costs that could be happening here. The cost of continuing to miss out on these activities you need to do or work. Just the cost of the pain itself and how it makes you feel. Poorer sleep, not being able to enjoy having company as much or go and do the things you want to do. A trial of laser visits is going to be affordable, whether or not your insurance covers it. Let me recap. Take a look at your condition. Put a value on it. How much is it costing you to continue to deal with this issue? How much time are you losing? How many activities are you not able to go and do? What about your hours at work? Are you having to cut work short? Get a real sense of how much it's truly affecting you. Many of us try and kind of gloss over, oh, I'll be fine, it's okay. And once you sit down and really look at how your life is different with this condition, it can kind of bring this home and say, you know what, this is something I need to get addressed. Go and get evaluated by a Laser Therapy Institute clinic. Again, you can find one on the website, lasertherapyinstitute.org, or send us a message and we'll help find someone near you that can help get you evaluated and see if laser therapy might be an option. And then they can talk to you about the costs that you're going to have to look at there. But I'm telling you, a trial course of laser, if that's appropriate for your condition, a trial course of laser is affordable. Whether or not your insurance will pay for it doesn't even matter. I highly encourage you, check it out. Get this thing taken care of now before it continues to cost you more money. Thanks again for joining me this week, and I hope you're here with me when I drop another episode next week.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.